My name is Leslie Fletcher. I'm a nurse practitioner. I'm standing here in our amazing Injectability Institute where we are hosting our first ever cadaver course duo weekend day. So it's Friday, March 4th, the cadaver lab, and Saturday, March 5th, the ultrasound lab. So our ultrasound lab is run by Dr. Weiner out of Florida, who's an amazing ultrasound expert. He's kind of one of the pioneers in ultrasound. We also have Dr. David Saadat here on Friday for our cadaver lab. Our cadaver lab is going to be very intense. So it's an 8-hour day. We are going to be able to have all the cadavers here on the tables, and we're going to be actually injecting them and dissecting them, kind of seeing where your filler landed, your Botox landed, make sure you're in the right depth and the right angles and which one's going to be more effective. And the good news about this is that we have the space here. So because we own the location, we were able to kind of keep the costs down a little bit, and we've looked around to see what typical costs are, and we've tried to make ours very attainable for our injectors, because I really feel like this is such an important piece of the puzzle. I've taken a few recently and they were very good, but the one thing I took away from them, A, it just confirmed some things that I was doing right, and B, maybe kind of changed a few angles and techniques that I was using that I wanted to change after seeing the dissection. But what I really found in common for these two is that they needed to be longer. They were not long enough. I wanted a longer amount of time. So we have this 8-hour course with Dr. Saadat, who is an amazing plastic surgeon out of Beverly Hills. He's also an otolaryngologist, board certified, and he is an instructor at USC Keck, and he also teaches for a lot of the pharmaceutical companies and does their cadaver course. And he's bringing a good friend of his, a guest appearance by Dr. Alexander Rifkin, who is, as everybody knows, kind of the pioneer of the non-surgical rhinoplasty. So I'm really looking forward to seeing him do some injections, possibly dissecting that cadaver on the nose and seeing what we're getting into there with that. But we will have live injections. I'll be doing an injection for mid-face and tear troughs. Dr. Saadat is going to be injecting the cadaver in the same exact technique and plane. Then we're going to peel back the cadaver and see where everything landed, so that you can get a good perspective on what you do with your patients and take that back to your practice. So I really think it's a great opportunity right here in Southern California to come in even for the weekend. You don't have to do both classes, you could do one or the other. Reach out to us, email us if you're interested, and we'll send you the registration form.